We are calling this the ProBiome Clinical Trial, and this clinical trial is recruiting dogs that have bladder cancer, and we're recruiting at 3 different sites currently. That is the University of Missouri College of Veterinary Medicine, Ohio State University, and NC State University. This trial is subsidized, it's heavily subsidized, so if an owner of a dog who has bladder cancer and that dog qualifies for this trial, this would be a very minimal cost to those owners for the treatment. What the treatment involves and what we're actually testing in this trial is the addition of a probiotic to a standard of care therapy for canine urothelial carcinoma, also known as transitional cell carcinoma, so TCC, which is bladder cancer in dogs. And that probiotic is called E. coli Nissl 1917. People are adding probiotics into cancer therapy, and they're not only seeing improvements in side effects, things like side effects, they're also seeing things like tumor reduction or prolonged progression-free survival, which is really incredible. So we really want to see if it can improve cancer care in these dogs, and that's the goal of this trial. We are collecting gut microbiome samples and urine microbiome samples from these dogs. Treatment regimen is 8 weeks long, so these dogs get chemotherapy every 2 weeks. They have their blood counts measured every week just to make sure to assess their white blood cells and make sure they're not getting too low. We're partnering with the clients to collect feces and urine and bring that to us. So the benefits for the client, whether you're on placebo or whether you're on probiotic, you're getting the standard of care therapy for your dog with bladder cancer. So the costs are going to be much lower if you were just, going in to treat your dog not on a clinical trial. Other benefit to this is maybe we'll learn about how something like a probiotic could be used to supplement cancer care and cancer therapy and improve outcomes. The other part of this trial that's a little bit unique compared to, a trial just testing maybe a different cancer drug is we are collecting these fecal samples and urine samples. So we have to find a team that's willing to go out there and get these samples. So we chose this probiotic for a couple reasons. One, we have clinicians here at Ohio State University that have tested it in healthy dogs and kind of looked at it over time to see if dogs tolerate it well. So we knew that that was going to be a good option. One of the other reasons we chose this particular probiotic is because E. coli is responsible for a lot of urinary tract infections. So it's one of the number one bacteria that causes urinary tract infections in dogs and in humans. Dogs with bladder cancer often get urinary tract infections. And so some of the thoughts behind working with this E. coli is the gut is thought to be a reservoir for the E. coli's that can cause a urinary tract infection. So these bacteria find their way from the gut to the bladder, and then they can potentially cause infection there. But there are specific types of E. coli that can do that. If we can give an E. coli to the gut and replace potentially some of these other E. coli that are there that are infection causing, maybe we can actually reduce something like urinary tract signs. So all in all, it had a good combination of safety, tolerability, and then the potential to improve clinical signs. The other thing that's kind of cool about it is E. coli can target tumors. So it can localize to tumor tissues. And what we're really intrigued to test in this is this E. coli, this probiotic, is it going to be able to localize to the tumor tissue and then ramp up a positive immune response? So there can be negative or inflammatory immune responses that are pro-tumorigenic, so they can cause the tumor to grow. But there's also an opposite kind of immune response where you can ramp up certain immune reactions that actually inhibit the growth of the tumor or promote immune cells that help clear the tumor. That's something that we have much less data on or evidence for, but we know E. coli can localize to tumors. And so that's something we're really excited to test and see if we can improve tumor outcomes. No requirements based on breed. We are looking for dogs that don't have a history of significant gastrointestinal or skin disease. So like if you've got chronic dermatitis issues or like chronic inflammatory bowel disease, we are ruling out those dogs because of the potential impacts on the microbiome. And we really want to understand the potential impacts on the microbiome without adding some comorbidities into that would also influence the microbiome in a different way. These dogs cannot have a history of radiation, chemotherapy, and they cannot be on antibiotics or have a raw diet or a diet with probiotics in the last 3 weeks. That's only within the last 3 weeks. So if someone wants to enroll, but maybe they're currently on a diet with probiotics or antibiotic, then they can cease that particular antibiotic as clinically advised and then enroll 3 weeks later. And that would be fine. As long as you are not changing that diet, you have no probiotic supplements, and you are not adding any supplements, and you are not changing that diet during the course of the trial, we can accept dogs that maybe just have some kibble that is pre-existing in their diet that does have probiotics in it. There are always risks associated with probiotics for potential gastrointestinal distress. So just like, if we go into the supermarket and we buy a probiotic, it could cause some gastrointestinal distress. We think the risk of that is very low based on what we've seen in dogs so far and based on the dogs that have already enrolled in the trial that have done very well.